Goeienaand, good evening, fellow South Africans and citizens of the world. And you've got to take your hat off to the ANC. They live in this world of fantasy. You know, the world where they can do everything even though they've run out of cash. And one of their biggest charades is the National Health Insurance Scheme. Consider the state of Johannesburg hospitals, the public hospitals in Johannesburg. Absolutely incredible. Due to a lack of basic medical supplies, all non-emergency operations were discontinued at the Johannesburg hospital. The problems have been going on for weeks, and doctors now have to beg for medical supplies at neighbouring hospitals to deal with serious cases. The Gauteng Health Ministry has confirmed that non-emergency surgery for some patients had to be rescheduled at Charlotte Maxeke Hospital in Johannesburg due to a shortage of medical supplies. Now, has anybody else realized that as the names of hospitals and airports and streets and roads and cities and towns get changed to some weird African name from the old historic name, like Pretoria, now being Tshwane and things like that? You know, has anybody else noticed that the wheels just seem to fall off after that happens in those areas or in those streets or in those hospitals? There's something very strange happening here. Probably what you call the Africanization of things in South Africa. Anyway, getting back to the story. We're talking about the health situation in South Africa, the public health situation, the public hospital situation. It's all in a state of collapse. This was in response to a statement from the Democratic Alliance spokesperson on health, Jack Bloom, who said about 20 patients had been told that their operations could not go ahead. Kwara Kekana, a spokesperson for the province's health MEC, Dr. Bandile Masuku, said 8 patients were affected by the issue. The patients were all scheduled for arthroplasty. Bloom said in the statement, there has been a problem for some weeks with procurement at this hospital. Specifically equipment such as suction catheters, oropharyngeal airways, laryngeal masks, arterial line transducers, suture dressings, and the correct size gloves were lacking at the hospital. Bloom said medical staff often have to borrow such equipment from other hospitals, and because of this, some elective surgery was able to go ahead, as supplies were taken from Helen Joseph Hospital. Bloom said it is shameful that doctors at a major hospital cannot do their jobs because basic medical supplies are short, with patients suffering as a result. He added that the National Health Insurance would not work if simple things could not be fixed in public hospitals. Kekana said contingencies had been put in place. Kekana said the hospital, though, intervened to arrest some of the challenges by borrowing stock from sister facilities and collecting stock from suppliers who had stock but could not make immediate deliveries. She added, a review of current quantities of critical stock items being ordered and a framework of orders will be developed from October until March 2020. This practice will continue until the new financial year, and any risk or challenges identified till March 2020 will be mitigated to ensure continuous improvement. The review, Kekana said, would include new processes to ensure timeless delivery of medical supplied equipment. Now, when did things change? Because pre-1994, you never had this sort of situation in a public hospital. You know, it is becoming absolutely ridiculous. But remember the old thing, we're going to turn it around, we're going to turn it around. Yeah, good luck with that. Anyway, Kekana says, what's that song? Simple Simon says, da-da-da-da-da-da. I think we should play that every time we have this sort of thing. Anyway, let me get back to the story. Kekana said, relevant clinicians were engaged and all have agreed to improve communication and work on implementing framework orders in this financial year to mitigate all risks and continuous improvement. Meanwhile, the ANC regime wants to implement the National Health Plan, but is currently unable to ensure that essential medical supplies are delivered to hospitals. Now, I do have to tell you that, I read a lot of the online news in South Africa, and what I've noticed is that the actual quality of English in many of these articles is just going pear-shaped. And I've just read one of the lines, and you can see what I'm talking about. Anyway, medical experts believe that the country's health service can collapse altogether if the phases of the medical schemes are phased out and the national plan collapses. Well, it's par for the course. Everything in South Africa is collapsing. Look at the municipalities. Look at the service delivery. Look at the ANC government. Look at the National Defence Force. Look at the South African Police Service. I mean, you can point a stick at anything. Look at Denel. Look at Eskom. It's all falling in a big hole. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video, and above all, stay safe. Bye for now.